The third topic is about globalization and COVID-19. I would like to use this case just to better understand the correlation and the linkage between the world trade, the globalization phenomenon, and how this event was amplified by the globalization, by the fact that there are millions of people, as I say, that moving from one country to another one for working reason, and how there is a strongly correlated with the spreading of this pandemic around the globe. So let's have a look at the impact of COVID on globalization. So we see that the globalization has altered the way how we live and earn a livelihood. We will see how the people, millions of people move from one country to another one because there is more job opportunity, because there are thousands of people that every day that move from the headquarters to different country because they have to present the service, the goods. So you can imagine how, for example, an international airport such as Dubai, where there are almost 1 million people that travel inside the same spaces from all the 195 countries every day. So consequently, the trade and travel has been recognized as a significant determinant of spread disease. That's the reason why in this lecture I would like to show you the relationship between the trade, the globalization, and also the determinants of how this virus can be spread, and also in terms of disease can be spread from one person to another one. And additionally, the rise in urbanization and the close integration of the world economies has facilitated global interconnectedness. Also, especially the urban area, imagine the urban area in China, imagine the urban area in the United States or in a European country. There are now people that coming from all over the world for job reason, for traveling reason as well. So there are several ways how the people they're moving from one country to another one, but the problem is the fact that most of the time they are concentrated in a urban area, because urban area is a place where several goods and services are traded, is a place where the people meet each other for meetings, for showing their products. There's a place where the people moving from job opportunity. And this is amplified and is recognized to be one of the most important aspects in terms of the risks of spreading disease and viruses. So therefore, the globalization has emerged an essential mechanism of disease transmission. That's the reason why, when we're talking about globalization in this course, we would like to focus on the risks of globalization correlated to the movement of people from one country to another one. So the rising urbanization and the closer integration of the world economy has facilitated the global interconnected and also the way how the people meet each other, especially in the urban area. Trade and travel are essential component of the globalization. We see how the movement, the migration of people and the trade are moving in the same direction and represent the key aspect of the globalization, and are also a significant contributors to the spread of infection disease. So the consequences of pandemic are not only defined in terms of mortality, but also their impact on our daily livelihood and economy, with the globalization accelerating this loss and costing billions of expenditure. So the pandemic affect the economy in terms of demand and supply. And the pandemic can also affect the economy in terms of accelerating the economic growth of affecting country, leading to a reduction in trade and increase in poverty. The COVID represents one of the most tremendous impact of the spreading virus around the globe, not just from the health point of view, but you will see how this affects completely the economy, completing our life, our style life, because was so dangerous around the globe, especially in EU, in the United States, where there was the highest cases of fatality and infected people, that indirectly affect also the economy, because there was the lockdown for almost 2 months in several countries, then the reopening, then they had to reclose because the virus continued to spread. And this is the typical case of the correlation between the health and the globalization. That's the reason why I want to show you that COVID has one of the most impacted viruses that was amplified by the fact that now our economy, our society are so interconnected between different regions, between different countries, that the health issues now represent one of the most important aspects that we have to consider when we're talking about the globalization. So in this map I show you, this is a research center that basically simulate how the virus was spreading, starting from China. You see how all the people that traveling for work from China, they first moving to Europe. In Europe, there was a boom of this virus, especially Italy. Italy was the first country that have dramatic impact of the COVID. Then it spread around all the European countries, including UK. Then start moving to United States. So this is a sketch that shows how the coronavirus impact, but this kind of representation is the same representation of the flow of the people that moving from country to another one for job reason. This is the same pattern of the trade, of the commercial shipping, of the people that traveling using aircraft. So there's a strong correlation between the globalization, the international trading, and the way how the coronavirus was spreading and was amplified by the globalization. Maybe 50, 60 years ago or 70 years ago, this kind of pandemic could be a very less impact, or maybe was concentrating just in China or some border around China, but with this completely different economic systems in terms of globalized trade, this amplified completely the way how the virus was spread around the globe. This is the map of cases of death globally. You see how China, European country, and the United States was one of the countries that was more affected in terms of that. But if you realize, if you see this map, you also understand how this happened in a richest country. Because the people moving from, for example, China to Europe, that there is a very strong connection in terms of commerce, in terms of trading. And also this represents the way how the virus was spread. So there is a strong correlation between the rich country, the Western country, how they develop their trade system that we call globalization. But at the same time, we have to consider all the health issues, the health risks, And the coronavirus represents the one of the most evident risks and evident impact of how the virus can spread around the globe, because it is amplified by the fact that the migration pattern of people now reach almost every part of our planet. So if we see the cumulative confirmed COVID-19 death by world region starting on January 2020, January the worst month was between February and March 2020. Then the virus will start to continue to spread around the globe. On the left side, we have the million of fatality of the people that was dead by the COVID. You see how the most affected country was the Asia, Europe, North America, South America, while the Africa and Oceania have less. Even if there are several studies that seems that the people that live in Africa are more resistant to this sort of virus. Anyway, you see how, for example, the people in Africa that travel much more less than the European people, than the American people, and the China as well. So that's a very strong correlation between how many people die in a Western country where the globalization market, the globalization economy is the predominant economic system, while different countries such as the Oceania, for example, or all the African countries have less, a much more closer economy. In fact, there was affected less. This is important to understand this kind of correlation. But at the same time, indirectly, this affects our entire economy and globally. So not just the economy that was affected by the coronavirus, but affected the global economy. So in this figure, I show the COVID-19 that has caused an economic shock that was 3 times worse than 2008-2009 financial crisis. In fact, if you see the percentage loss in terms of GDP starting from 2005, there was the first recession and economic crisis that start from the USA financial crisis that then was affected all the global economy. Then there was a period between 2010-2020 that was quite constant. There was some Eurozone or United States or UK that start to increasing their production and the GDP was good. Then see what's happened a couple of months after the pandemic of the coronavirus. So there was the loss of almost 10 point of the GDP in almost the country that are present in this graph. It was Japan, United Kingdom, all the Eurozone that include 27 countries, and all the United States. So in some way, the globalization increased, the trade increased, the opportunity for several countries to increase the economic growth, increase the opportunity, the job opportunity, but at the same time is strongly correlated to the risks of spread of the virus. And the COVID-19 represents the most evident way how this kind of phenomenon called the globalization, they can affect the entire world and indirectly also affect all the economy, because this was one of the worst dramatic pandemic after the Second World War, and it was 3 times higher the loss and the shock, the economic shock, compared to the economic crisis of 2009. And if we see also the GDP growth rate that was published in 2020, the first quarter, you see how almost all the countries around the globe, they have a loss around between the 4 and 6%. So we're talking about thousands of trillion lost, million of job lost, and then indirectly this affects also the health of the people, because especially in a poor country, if you see the impact that have in a country such as India or South America, there was tremendous the impact, because there was the lost job, there was the increase in violence, there was an increasing of loss of job that creating, especially in a poor country, a worsened situation in terms of accessibility to the food, to the primary source of healthcare. So this affects not just the economy, but the fact that the economy was completely shut down. This affects also the health system of, especially on the poor country. The rich country, in some way, after a few months, they have enough funds to compensate in some way this tremendous situation. But there was several countries, such as, for example, India, that the loss of the job, the worsening of economic situation, the increasing the poor situation in terms of food availability, in terms of healthcare systems, in terms of aid the most vulnerable people. So that was I show you the COVID-19, the pandemic, just to see how the globalization, how the migration correlated and trade are at the same time very risky from the health point of view. We'll see the following question that you will thinking about after you will read again this presentation. And now let's summarize this lecture. We'll see how the globalization has the potential to improving health of poor via transferable health technology, income and price effect. There are also several all the new threats that ignore and deny the health costs of globalization, but they are also due to distortion in market functions. And in some ways very simplistic and inaccurate to describe globalization as a good or bad for health. We see how there are some very good and positive effects in terms of increasing the spreading of the knowledge, increasing the market and trade of vaccine, of drugs and medicine, but there are also some bad indirect effects, such as in case of the COVID-19, as you see how this virus can be spread around the globe. That's the reason why also in the next lecture we will continue to treat and analyze the correlation between the trade and healthcare system and how we can increase the control and how we can reduce the risks, even if in this case of the COVID represent a failure, because it was so quickly the way how this pandemic was spread around the globe that represent a failure in terms of any sort of health policy and control around this event. Thank you very much, and see you on the next lecture.